was late one night and we got a call for a motor vehicle accident, a rollover on one of the highways out in the remote parts of the Northern Highway. When we got there, it was a family, a mother and a father and two small children. So the car had actually gone into the soft verge of the road and had rolled over, and all of them were quite serious. The doctor and the medical team that were there obviously had to work on site because we were in the middle of nowhere, and it was quite a stressful time. Even though they were quite badly injured, we managed to stabilise them there. We got them on board the aircraft and we got them back to Perth, and they all ended up making a full recovery. So that's the reason why I do the job.
The Royal Flying Doctors Service is one of the most innovative organisations in the world in the delivery of healthcare services, and has been since day one. Our mission is quite clear, and that is to deliver the finest care to the furthest corners of the country. It can be a mother about to give birth, it can be somebody with a road accident on the side of a highway somewhere, it can be somebody on a mine site in the far north of the state. That means that we need a reliable aircraft that is going to be able to access the furthest corners of our state, which is 2.5 million square kilometres of distance. For us, the Pilatus PC-12 is our aircraft of choice because of its reliability and the fact that it just continues to perform for us.
The aircraft is state-of-the-art, Pratt & Whitney turbine engine. The avionics suite is Honeywell. The aeroplane's pressurised, which means we can fly quite high and still have a comfortable cabin for the occupants. It's equipped not only for the pilot's point of view for the best avionics suite, medically it's fitted out for the benefit of pretty much any patient that we need to carry. It's a flying intensive care unit.
We work our aircraft really hard, as you can imagine, because we have to be there wherever and whenever a patient needs us. Annually, our 14 PC-12 aircraft fly about 1,600 hours each, which, to put it into context, I think the average for most private operators around the world is probably about 200 hours a year maximum. Annually, we fly 8 million kilometres, which is the equivalent of about 200 times around the Earth. We fly 365 days a year, 24 hours a day, all weather conditions, and quite often landing on unprepared remote airstrips, dirt and gravel.
Everyone's always rather happy to see the Royal Flying Doctor Service pull up on their strip because generally no help has arrived.
Pilatus have been fantastic partners of ours right from 2000 when we first introduced the PC-12 aircraft into our fleet. Not only in terms of providing a fantastically reliable and safe aircraft, but also in terms of support, in terms of really a relationship that really understands our business, understands the type of operations we fly, understands the areas and the conditions we operate in, and forever working with us to make sure that their aircraft meets the needs of our patients and our people. I think if the Reverend John Flynn was to be here today and have a look at the Flying Doctors and what we're delivering, I think he would say that we have totally fulfilled his vision. His vision was always to take the finest healthcare to the furthest corners of the country and be delivering health outcomes for people most in need. And I think he would unequivocally say that today we're doing exactly that. We're doing it in far more innovative ways. We're doing it for far more patients than I'm sure he ever envisaged. And some of the technology we use, whether it be the aircraft or the telehealth and the video conferencing, I'm sure he never would have envisaged that. But the core purpose, the core reason for being and the core vision that he had, I think we're fulfilling more than ever today, and I'm sure he would be proud to still be associated with the Flying Doctors today.